And welcome back. Dr. Mark Simpson with Simpson Dental Associates joins us now. And if you have a particular question to ask the dentist, here's a number on your screen, 1-877-924-7888. And Dr. Simpson, thanks for stopping by. You
It's always a pleasure.
Bring the funnest
I
props.
do. What I thought is you ask people, do you want whiter teeth? And people always say yes. I've never had anybody say no to that question. So let's kind of go through the gamut of things. First of all, they can claim whitening even if they just remove surface stain, which is all they really do, okay? So, I mean, yes, you might get some improvement if you have stains on your teeth, but generally I find that people aren't really too crazy about the results they get. The next thing up would be like the strips. Okay, the whitening strips, and those work pretty well. The problem is keeping the strip in place. The next thing would be a tray that's not a custom tray, and you put the gel in there. The problem is it doesn't fit your teeth that accurately, okay? The third thing would be a stronger gel, and this is about maybe 22%, and that's a custom tray. So that's going to do much better job. The third is Zoom, which is about a 38% solution. And you see we have to isolate the teeth and keep the material from getting on the gum tissue in order to whiten. So you get far better results with Zoom, which is an in-office type whitening, as opposed to over-the-counters, which are generally like 10% solution. So remember, 38% solution when we use in the office, and a 10%. So let's talk to Brandy on the line there. Brandy, what question can we answer for you?
I just basically, I guess, wanted an opinion.
Okay. What can I help you with?
I only have 18 teeth left, and I went to the dentist a week ago to try to get partials.
Okay.
And he told me that I didn't need partials to be able to eat. But I find that when I chew stuff, my jaw gets really tired and it leaves my gums really, really sore.
That's a great point, and I agree with you. You do need a full complement of teeth to chew properly. You know, some people are missing some teeth and do okay, but what I find is people have more stomach problems when they can't chew their food properly. So I'm in total agreement with you. You need a full complement of teeth. I would look towards either partials or perhaps some implants would be a much better solution because they're fixed and they don't come in or out, and you would like that much better, I assure you. Lynn, how about your question? Yes, Lynn.
Is Lynn on the line?
I am. Can you hear me?
I sure can. What can we help you with?
Okay. My mother is 78 years old. Last year, well, she had every one of her teeth pulled out when she was like in her early 30s.
Oh, I'm sorry to hear that.
She lost all the calcium when she had her children. But she's 78 years old. Last year, she had a hurting in her gum, was able to pull it out, and it was an old tooth that was that she had pulled out of her gum, which was brown looking, but you could tell it was a tooth.
Right.
And then the year after that, or the year before that, whichever, she found another one come out of her gum. Is this normal?
It really can be, and it depends on the situation. Sometimes when a tooth breaks off, when you're taking a tooth out, you have to ask yourself, am I going to do more damage by trying to get that piece of tooth out of there than I would be by leaving it behind? And so what we do is inform the patient and say, hey, there's a little piece. I did not take it out because I was afraid I would do more damage. And generally, they do work themselves to the surface over time. So, well, not to worry about that, except for your poor mother not having no teeth. Now, Jim, how can we help you?
I've got two questions. One question, quite a number of years ago, I had a root canal done on a lower tooth back toward the back of my mouth. And the tooth is still in my gum. I tried to have it pulled out and a couple of different times. They couldn't get it. They said the root was too deep. And I'm wondering if I could get that pulled out. And the other question is, on my upper gum, whenever I put a toothpick in to try and get a piece of meat or something out of that, I have a little bit of an odor And
Right.
from time to time, there's a little bit of blood there, and I'm
That's
wondering
a sign that there's
if
infection. So if you heard the question right before, sometimes that piece of tooth will work itself through. If not, yes, that tooth can be taken out. It's just a matter of finding the right guy to do it. Some people do that type of work and some people don't. As far as the odor in the area in the upper, I bet there's a space that the food is cramming in there, and then what's happening is you're getting infection around that. That's where the odor is coming. Attention, it's an infection in your gum, so get that look.
Advice and good questions today.
All right.
Up and by. Thanks for showing us the different variations of teeth whitening, and you recommend Zoom is the best.
If you want the best result.
Yeah. All right.
All right.